Hope Channel, changing lives.
Good evening and welcome again to Hope at Home. We've been having this discussion on COVID-19, and today before our discussion we'll have an interview with Honorable Kojo Opong Nkrumah, who is the MP for Fasa Yobe constituency, as well as the Minister of Information. And so Honorable Kojo Opong Nkrumah is online right now. We'll be having this conversation via Zoom. So welcome Honorable to Hope TV. Honorable, good evening. All right. I hope you are doing well.
Very well. How are you doing as well?
I'm also fine. And we'll start the discussion by looking at what the government is doing right now when it comes to COVID-19, looking at the objectives that the president has set for us all: limit the importation, contain the spread, provide adequate care for the sick, limit the impact on socio-economic life, and also inspire the expansion of our domestic capabilities and self-reliance. So if you can please tell us where we are now in this fight. Are we making progress?
I think the evidence is clear that we are making a lot of progress. The baseline situation is when you're in a situation when you don't have a system that is
okay, please. We'll try and work on the lines and get back to Honorable if the line is very clear. But I'm still having an interview with Honorable Kojo Opong Nkrumah.
Scenario. Can you hear me, sir?
Yes, it's fine now.
Yeah. As I was saying earlier, the dreaded situation is when you don't have clarity on what is happening. You don't know your rate of infection within your jurisdiction. And what ends up happening is that by the time you notice, thousands of your population have contracted the virus and rushing to the hospitals. Your healthcare system is collapsing. Doctors and nurses are getting infected, and you're not able to contain it. So that is the situation that you dread. So what we've done here in Ghana is a 5-part strategy, which as a first step was aimed at ensuring that we limit importation.
Okay.
I think the evidence has been clear that we issued travel advisories that in a single day cut the number of people who are coming from abroad to Ghana from about 7,000 to a little around 2,000, around the 15th of March thereabout. And then we proceeded to even for the small category of those who were coming at the time, because there was no legal basis. We couldn't stop them from coming to Ghana, and those who had Ghanaian citizenship. Those our borders, and even proceed to mandatorily quarantine persons who were coming within our borders. In the end, we stopped about 115 cases from getting into the general population. But thankfully, a good number of them have been able to treat and have recovered and are now back home. Apart from that as well, the second part of our strategy is to contain horizontal spread or local spread here in Ghana. So you notice that we've been embarking on what we call an enhanced testing regime, which allows us to go ahead of the virus. Instead of sitting and waiting for people to fall sick and come to us, we go ahead of the virus. Persons that we think are at risk, we are able to test them, ask them to self-isolate, and if we find that they are positive, move them to treatment centers and have them treated. And that's how come today we've done that very aggressive exercise, which is leaving us with a little over 843 cases that are being managed. Yeah, and just as that, let me quickly mention that the Ghana Health Service has explained, I think if I've seen their statement pretty well, that they have started clearing the backlog. And it's out of this backlog that they are finding some of the extra numbers, but these ones are being contained. And then, yes, of course, they are providing care, good care for the sick. That's how come so far almost 100 people out of this 834, almost 734 thereabout. And it's because they are providing adequate care for the sick. They are doing it in a manner that ensures that our hospitals are overwhelmed, and we are doing a lot of local production of PPEs and other things that we need locally, because the world is in short supply of, logistics. At the same time, we are also working to ensure that the socioeconomic impact on our population is mitigated by some of the social protection programs that we've introduced. So, by and large, Ghana is holding its own in this fight against COVID-19.
Okay, so you mentioned earlier that the number we have now, 834, is because of the backlog that we have. And so we shouldn't be scared with the numbers we have now. Hello, Nabu.
The numbers will go up. Yes, I can hear you. Can you hear me?
Yes, I can hear you now.
Yes. We already mentioned, even before we started this enhanced tracing and testing module, we already mentioned that the numbers will go up. The numbers will go up because you can, be in a situation where you say, I'm not testing enough. You won't even have numbers to show, and you deceive yourself that your numbers are pretty low. But we have decided to go for an aggressive testing routine, which means our discover the numbers. The numbers will go up, and then as we provide more treatment, positive cases in Ghana, about 834. We're also quick to mention that 99 have recovered.
Yeah.
So your active cases come down. So the more you test, the more you find, and the more you can treat. It's a better approach than deceiving yourself that you are not testing enough and therefore you are not finding enough. And we have always said that you should be concerned, but don't panic. Be concerned so that whatever restrictions are imposed to ensure that you don't become part of the statistic, you can observe those restrictions, and then we all don't become part of the statistics. But don't panic, because the more we test, the more we find out, and the more we're able to give them treatment. So it's a good thing to test and find the numbers so that you can deal with it.
So then that is why I think the government is very particular about we staying at home. Because one of the questions we had is, why is government so particular about the fact that we should all stay at home, to the extent that we even have soldiers and other security agencies on our streets to ensure people stay at home?
Yeah, because what we've said is that we need people to stay at home for two things: to minimize the rate of spread in these first 3 weeks or so that we are trying to get ahead of the virus, and also to, more importantly, allow the people and test them. It is the reason for which we've been very hard with this instruction that people should stay at home. And I think that so far the numbers show how much success has been achieved in this area.
Okay.
It's not been easy. Not everybody has been complying. People have been jailed for not complying already. But I think by and large, a lot of people have done their best to comply.
There's even a video we saw last night about market women selling at Accra Brewery around 10 p.m. I don't know whether it's come to your notice and what we're going to do about it.
It's good to acknowledge that it's available with the security agency television.
Okay. The other issue is about stigmatization, and we saw what happened on Thursday. We had one gentleman who had recovered come and speak to the whole country about it. What else do you think we can do to help reduce the stigmatization that's going on, even particularly about some health workers who are being stigmatized against because they work as the frontline health workers?
Yeah. I mean, I was telling a joke the other time that when I go to Parliament these days, my colleague MPs call me COVID-19 minister. Even for me, though it may sound like a jovial matter, you begin to see people tagging you with it. But admittedly, for health conditions that people don't have a deep understanding of it, often there's a lot of stigmatization. But stigma is dangerous because it will make people go underground, they'll hide, and they won't come forward to be treated. It will make people reject isolation and treatment centers that are being put up in their own localities. And it would make it difficult for people who even have symptoms to step up on their own and have an opportunity to be tested. And so all of us need to get deeper understanding of what COVID-19 is. It's not a death sentence. It is an enhanced version of a flu, if I may put it simply, dire consequences. And that's why people need to take a lot more precautions. But we all need to rally together and fight stigma. And that's why platforms like yours are important in helping people to understand, step forward, be treated, and get care.
Okay. And the other question is, what do you expect the churches to do to help you in this fight against COVID-19?
Strong following. That is very often for those of us in, may I say, communications and law, who say that church audiences are almost sometimes dogmatic. What the church says is very much followed by members of the church, as against what other agents of society may say. And so churches have a very key role to play in helping us to spread education and knowledge and get people to understand that it is in their own interest to comply. That is why when I was informed of your platform, I thought it's very important to make time to be with you because people will listen to us and do what they have to do.
Mm-hmm. Okay. And our church has hospitals, we have clinics, and other health professionals around. They're also doing our best to educate the congregation, educate more people about COVID-19, allay their fears, but still ask them to stay at home. So also doing our best to help you in this regard. One of the questions we had from our church members is, some of them own SMEs, and so is there a plan for them, even now, to even pay their staff, or even after COVID-19, what help for them?
I think the government made available 600 million Ghana cedis, which is supposed to be used to support, has been requested to lead that project. And in the coming days, they should be able to provide some more details on who qualifies, how do you access it, which banks and financial institutions can you access it from.
Okay. And there's another issue about the food distribution and social distancing. We've seen videos of people rushing for food. There's no social distancing. What do you say about that, so our members get to know?
Well, it's been fair, and government has had opportunity to speak against it, that for all of those who are distributing relief packs, including government agencies who are distributing relief packs, it's important to observe social distancing. If you can't ensure that social distancing is happening, then what you may be doing may even become counterproductive. And so it is important that these persons observe it. I think since we put that out, we are beginning to see some improvements in the relief pack distribution exercises, and we look forward to more people complying with the guidelines for distribution of relief packs as has been issued.
Okay. If this lockdown continues for a long time, is there any plans for those who earlier on were not vulnerable, but as we continue to have the lockdown continue for a long time, they become vulnerable? And anything for them, food, money, and all those things? Is there a plan for those people who prior to this lockdown were not vulnerable?
So all of that go into what you call a cost-benefit analysis.
Okay.
And they are the things that weigh in on the decisions that the president is making within the next set of hours, so that he can inform us about it, hopefully by tomorrow.
Okay.
And if he chooses to extend it, of course, some provision will have to be made for persons.
Okay. The security officers at these checkpoints has been turning people away, people who are exempt from the lockdown. An example is one of my patients from the dialysis unit in Kolebu. These people show a letter we've written for them to show the security agency, and they are still turned away. Is there, I don't know what we could do now for these people. If they're watching right now, what do you have to tell them, please?
I think for these persons, maybe what we have to do is to get the medical facility that is offering them the kind of help to very quickly engage with the security apparatus so that they can be assisted to make their way to the necessary health centers. But let me take advantage of your platform to reiterate that health services remain open. They're not supposed to turn patients away or stop people who are going to the hospital or to the pharmacy. But you also do acknowledge that people have been taking advantage of it. There's an interesting story told by the police that somebody can buy one ball of kinky and go around the whole of Accra. Every checkpoint you meet him, he says, oh, I just went to buy kinky. So the security authorities are also now being a bit more circumspect and are not taking some of these IDs and documents on face value. I think that is what is contributing to some of the challenges. But it will help if the health institution is also able to work with us to get these persons some necessary passes so that they can get the kind of treatments that they are looking for.
Okay. And the last but one question before we let you go is, Wanda says that we miss our churches, we miss our fellowship among our members. And the question is, will we be going back to church anytime soon? Okay, so we're trying to reconnect with Honorable Kojo Opong Nkrumah. So for those of us who just joined us, Honorable, can you hear me now?
Yes, I can hear you. I'm saying that unfortunately I can't predict what the next steps will be. But for all of us who have not been able to fellowship with our members, or like the Bible says, be in the assembly of the saints, we are trying to connect by technology currently, television or online, and it is our collective that this wind will pass quickly so that we can get back together with the brethren back in the places where we worship.
Okay. And what will be your final words of hope to all Ghanaians, those of us are watching you? What should we take home?
I think first of all, we must understand that throughout life, challenges come. But God has his children under his wings and always comes through for them to protect them and to ensure that in the end, it ends in praise. This will pass, it will end in praise. We also must do our part by observing the etiquette and protocols have been outlined for us. Wash your hands regularly with soap and under running water. In the absence of that, you use the alcohol-based hand sanitizer. When you have to engage with people, do well not to shake hands and keep a physical distance of at least about 1 or 2 meters from people. And if you are coughing, use a disposable tissue and dispose of it by the time you are done. If you don't have to go out of your home, stay at home.
All right. Once again, thank you too. But just to say that we've been praying for you. The church has put together a program where we've dedicated 100 days of, from the time the COVID started till June, to be praying for you, be praying for the health workers, and we are hoping that, as you just said, this too shall pass and it will end in praise. Once again, thank you for joining us.
Thank you so much. Thank you so much.
God bless you. So we just finished an interview with Honorable Kojo Opong Nkrumah, who is the Minister of Information and also MP for Fasa UAB. We'll go for a break and then we'll continue with our discussion today on COVID-19 and kidney failure. Please take note that our WhatsApp number is 0559 680066. 0559 680066. We'll be right back after this break.
Tengo miedo.
I am scared. Sono spaventata.
Tous les jours, je vais sur un champ de bataille.
Dejo a mi familia.
Ich verabschiede mich von meinen Kindern.
I leave the safety of my home.
Og ég fer í stríðið gegn þér.
Contra ti.
Ne răvășești lumea.
Porti via vite preziose.
I will apply all measures necessary to save a life.
Je vais aider à sauver des vies.
Dar am obosit.
I am tired.
Estoy cansada.
Ulmer.
Épuisé.
Estamos cansados, pero no derrotados.
Bemühen tröka.
Ich werde es schaffen.
Veré gente luchando por vivir.
Vedrò i colleghi ammalarsi.
M-aș putea îmbolnăvi chiar eu.
I will see people die.
Yo veré a mis colegas morir.
Potrai morire anch'io.
I may die.
Je risque de mourir.
Dar, dragă coronavirusule,
I have taken an oath.
Un juramento para sanar a todos los seres humanos enfermos.
An oath to fight the fevers.
Un juramento para combatir la neumonía.
Ett löfte om att bekämpa virus.
Il giuramento di combattere te, nostro nemico.
Pero no estoy sola.
Wir sind viele.
Querido coronavirus, estamos unidos para derrotarte.
Nous sommes une armée de soignants.
Somos un ejército de profesionales médicos.
We are superheroes.
Suntem supereroi.
E non sono solo.
Pero no estoy solo.
And our patients are not alone.
Nuestros pacientes no están solos.
Nosotros no estamos solos.
We are not alone.
Dios está conmigo.
Vöd med oss.
Estamos unidos.
Unis.
Unidos.
luptăm împreună.
We are all in this together.
Okay, welcome back to Hope at Home Health Discussion. And for those who just joined us, we just ended an interview with Honorable Kojo Opong Nkrumah. He gave us some few perspective about what's happening now, with what the government is doing to ensure that the COVID-19 pandemic is brought under control. But one point he left us with is that whilst we keep on praying, trusting that God will help us overcome this virus, let us also take the precautions serious. And we will mention some of them in our discussion today, so you get to know what these precautions are. For those who have been watching us from day one, I want to say a big thank you to you. I get the feedback, I think on a daily basis. People call and tell, I've been watching you, I have my cautions, I'm enjoying it. I pray that you continue to watch us, and that before the COVID-19 lockdown is removed, all of us will be well educated about COVID-19 and will not fear COVID-19. Today we'll be talking about kidney disease. We mentioned earlier that for COVID-19, there's so-called comorbidities. These are diseases that makes the virus have an effect on you. And when you have the disease and also get the virus, your chance of dying becomes a bit more greater. And that's what we've been discussing. We started with diabetes, we've spoken about hypertension. Today we're talking about kidney disease. If you have kidney failure, your chance of getting COVID-19 becomes high. And when you get it, the tendency of having issues or even dying from it is very high. So we'll be discussing kidney disease today. To help us do our discussion today, we have our brother Sebastian Benny. He works in 37 Military Hospital in the dialysis unit. Sebastian, how are you doing?
Oh, fine, Mr. Makion. How are you too?
I'm also fine. Everything is fine, right?
By God's grace.
Great. And we have Dr. Sebastian and Dr. Sheridan Davis. He was said the first time we started this program to talk about COVID-19. He's joined us again today too. Sheridan, how are you doing?
I'm fine, by God's grace.
Everything's fine. I'm also fine. The family is doing well. All right. So we'll start with general issues about COVID-19. I'll start with you, Sheridan. What do you want to tell us about COVID-19? We just want to have a recap from symptoms to prevention. Anything we want to talk about now, we can do that before we go to the kidney disease, which will be our focus for today.
Okay, I want to welcome all the viewers once again.
Sure.
The first time I came here, we had an elaborate discussion on the COVID issue. We discussed what it was, the mode of transmission, and over the past 3 to 4 weeks, we've had a surge in the numbers. We started with 2, and then we're around 860.
834.
834.
Sure.
Yeah. So we realized that it's something that is real and it's with us. So as throughout the 2-3 weeks, we've had the president do a lot of initiatives just to curb this. And I want to encourage all Ghanaians that they should continue to adhere to whatever directives we are having from the President, Ministry of Health, and all other bodies concerned, because this thing is something that we shouldn't take lightly.
Okay. Can we remind ourselves with the symptoms of COVID-19? We said there was cough. What else?
There is fever. There is difficulty in breathing. Sometimes fatigue may even set in.
Okay. But we said that these are not peculiar to COVID-19. And so if you have these things, you have to call the numbers that the government has brought so they can also come in place and then help you with it. Let's talk about how do you diagnose that someone has COVID-19, Sheridan?
So initially we have to look at the history correlated with the clinical symptoms and then the laboratory investigations.
Okay.
So initially the thought was the travel history, if you have anyone coming from outside into the country.
Okay.
But now we are having the horizontal transmission. So once you are able to identify that these things are present, the travel history, the person is showing signs and symptoms and has come into contact with anyone who has these signs we've mentioned as a fever, high temperature, cough, sore throat, runny nose, those things can have an idea. And this is the time we are where we have to have a high index of suspicion for COVID.
Yeah.
So now basically we are treating COVID until proven otherwise. So once you have this history and the physical signs, you move on to the investigation. So you call the numbers, you have the samples taken, and then in a matter of hours or days, we get a confirmatory test from those the laboratory, whether they are positive or not.
Okay.
And that is where we can test whether someone is positive or not.
Okay. And we are hearing of recoveries, meaning that the management is going on well, right?
Yes.
How do you prevent it?
The prevention is what the Ghana Health Service, the ministers, the top hierarchies are all giving us: stay at home. The caution of staying at home is not that we are preventing you from doing your normal activity, but we are trying to help you not to come into contact with someone who has had or who is even having the infection, or you don't even know the person having any travel history. So we are just trying to advise all of us to stay at home. That's the major prevention we are all trying to do: stay at home. While staying at home, you need to take in more water, you need to eat. But there is something we are not trying to emphasize more about. It's exercise. People are not exercising, they eat and sleep, eat and sleep. So the question I always ask is, what will be the result after COVID-19? Are we going to record a different disease altogether, or we are still going to talk about COVID-19? It is time we have to come out and tell individuals that, no, in as much you are staying in the house, you need to exercise.
Exercise at home, but not to come out of your home.
No, even if you not even go out, walking for a long distance with your family wouldn't mean that you are going to bring the sickness to the house. We 1 kilometer walk with your own family.
You can even do the exercise in your home.
But sometimes doing exercise in your home can prove laziness, because when you sleep in your bed, you may think you are exercising, but actually you're not doing anything. But some of us, we stay in a compound house where you don't have that luxury of space. You can schedule with your family that maybe every 4 o'clock, 5 o'clock in the evening, 6 o'clock in the evening,
you take a walk around area,
just to burn what you eat, not to sleep on what you eat, because digestion is something you can't even calculate. But people eat, and after eating they just go and sleep. So that is all I've been thinking about. What will be the result after COVID-19? So in as much we are staying in the house, eating well, we have to also exercise.
Okay. We talk about hand washing, which we've been stressing over and over again. Using sanitizers, avoiding contact, handshaking, don't bring your hands to your face. We talk about all of these things. So we are hoping that those who are watching us and we ourselves will go by them, especially with not touching your face, because it's easier touching your face than not touching your face at all. That is fine. Now let's go back to our discussion today: kidney disease. What are the kidneys? I'll start with Dr. Sheridan. We say kidneys. Why are they even located?
The kidneys are one of the vital organs that God gave to mankind.
Okay.
In simple, I would say the kidneys look like a bean shaped.
Okay.
Or let's say your computer mouse that you use. That is how the kidneys look like. And they are located retroperitoneally. That is our back, around the lumbar region. That is where you can find the kidneys. Yeah.
Okay. And how many are there? How many do we have?
We have 2 kidneys.
Someone said that one kidney can sustain you, even if, you have to say if one breaks down, the other one can sustain you. Is that true?
Yeah, to some extent, it is true. And then it depends on what makes the other kidney not available. Okay. If something that is systemic, that is a condition that is affecting the whole body, and the one is not there, with time, the other 2 become compromised.
Compromised. Oh, okay. What's the function of the kidneys?
Basically, the function of the kidney has been grouped into maybe 3. Regulating water, removing waste, and the second one is hormone production. So those are the basic things we should have it in mind. That
can we start? Let's do on the first one first.
So the first one, let's group it this way: regulate. So in as much the kidney is regulating water, so electrolyte balance, the amount of fluid you take, the amount that has to come out.
So it ensures that there's a balance in the water in the body and those that comes out.
Yes.
Okay.
And the second one is remove waste.
Okay.
And the waste we are bringing is what we all see, the urine that we bring out.
Oh, okay.
And the waste we are bringing, there are things in the urine that you are bringing out which need not to be in your body.
Okay.
So what the kidney is, what the body needs, it will give it back to the body.
Okay.
What the body doesn't need, it adds to the urine and it comes out.
Okay, so urine production is solely the work of the kidneys?
Yes.
Okay. Any other function of the kidneys?
The kidneys help us to absorb important I'll say minerals or elements like vitamin D, calcium. These are very important things that the kidney does. Another function of the kidney is to help in the production of what we call the erythropoietin. That helps to build our red blood cells and give us blood. Yeah, so it's a very important part of the kidney. So realize that if your kidney is compromised, then you're having a problem with maintaining a normal blood level, maintaining a normal calcium and vitamin D levels.
Okay, okay. And I also read that the kidneys help us balance or regulate our blood pressure. Yes. How do we explain that too?
So when you look at the blood pressure, as Doc rightly said, it produces a hormone. And those hormones we are saying, we have one called renin. And the renin is being produced in the body to help maintain the blood pressure. Now, your kidney is now being compromised. How is the renin being produced even to regulate the blood pressure? Okay. That is another problem. So once the kidney is not functioning, those hormones that has to work is not able to produce very well. Okay, another one thing we also have to notice, even in the course of having kidney failure, sometimes the renin is being produced. Okay. So you can get excess. So you get people who are having kidney failure, but their PPs are very high. Okay. So it has so many factors coming together to cause the hormone being the hormone can be produced, but it will end up having high BP, or it will not be even produced at all, which will also cause another problem.
So it means it's a very vital organ, very vital.
Very vital.
That needs to be protected.
When you even look at this, I said 20% of all blood production is from the kidney. So when the whole blood is produced, 20% is found in the kidney. So assuming you have 100% and 20% is only in the kidney, then when there's a problem with the kidney, the whole body will suffer.
Do you have many? Yes,
please. Just to add to what he said, about 25% of cardiac output, that is the amount of blood that the heart pumps out, 25% of it passes through the kidney. So realize that the kidneys is very, very important. That is why the heart has to supply it with enough blood.
So, so how come this very vital organ can be compromised? What causes it to be compromised? More or less, what causes kidney failure?
So what we can say is diabetes, hypertension, certain lifestyle diseases can all lead to the failure of the kidney.
But coming on, diabetes and hypertension, they are the major cause of kidney failure.
They are the major cause of the kidney failure. When you even take hypertension as a whole, you see hypertension is as a population that we are using vessels in our body. And when those vessels are blocked,
the blood vessels, you mean?
Yes, the blood vessels are blocked. Okay. It causes narrow. The vessels now become narrow. Therefore, there's pressure being exerted over there. And when you look at the way the kidney itself is a bean shape, and inside the beans we have the nephron, and that is where urine production normally takes place. And when you go inside the nephron, they said there's something called a glomerulus. Let me bring it to our layman. Those who have been preparing our mothers who have been preparing our will give us more insight. Have you seen the colander? Majority of our patients don't even take their medicine. Doctor will rightly tell us when you give them the medicine, instead of them taking it rightly, you see they will take 1 to 3 days per. They said, and one thing they have to know, once that you give them hypertensive medicine, that take it 3 months. The report, they take it for the first 3 months.
They don't come again for review.
They will not even come. They will end up going to the pharmacy or drugstore to go and buy. You remember the doctor giving the medicine 3 months is trying to tell you something. Go take the medicine and come. Let me check again and see if the medicine I gave you is really working or it's not working. So if it is working, then that means I have to reduce the medication I'm giving to you. Or no, the medicine is not working. I have to change it for you. Or I have to increase the doses of the medication that you are. But human being as we are.
So that means for those who have hypertension, they should take.
They are at a higher risk
of getting kidney
failure.
And then you also mentioned diabetes too. So if you have both diabetes and hypertension, then your chances risk becomes high. Any other cause?
Okay, so you can have common infections. We can group the causes into, let's say, pre-renal, renal, and then the post-renal. So
let's try and explain that. The pre-renal means.
Okay, let's see the kidney as one structure, or let's say a house. The things that destroy it could come from outside before you enter the house. And the things that can also destroy the house will come from inside the house, and then the other thing to come from, let's say, another outside. So that is by mean the pre-renal, renal, and then post-renal.
So before the kidneys,
in
the kidneys, and after the kidneys. Okay.
Yeah. So in the kidneys, example could be the infection. When you have recurrent urinary tract infections, when you are not treating it very, very well, in a very long time, it can affect the function of the kidneys. The nephrons will be affected and can also lead to kidney failure in a long term. And then you look at, let's say, the post-renal. That is after the kidney. So, as my brother really said, you have the kidneys, and then when you come down, we have what we call the ureters. That is what collects the urine out of the kidneys. So, if you have that structure which is coming out of the kidneys blocked by, let's say, a kidney stone or anything, what happens is that there's a build-up of the urine.
Urine in the kidneys.
Yes. So, what happens is that there can also be a backflow. So, when these things to accumulate, my brother rightly said that the urine excretes the waste substance. So it's like the waste substance are accumulating in the kidney, tend to accumulate, then they'll compromise the function of the kidneys, and then in the long term will lead to the kidney failure.
Is there anything you want to add to it? Because I also read about alcohol and herbal concoctions. We have to talk about it. How does the herbal concoctions.
Mr. Mark, when you start bringing herbal concoctions, that means you are trying to support the work of.
Oh no! I mean,
see, our people are also trying to bring out their medication.
Yeah, but there should be a standard. Once it's standard,
you see, the statement is when they bring it out, it is written Food and Drugs Board certified. So when they how then do you tell them that the medicine they are selling is not standardized? It is right now, once it has been approved.
Sure, it is
but have it in mind that alcohol itself is a leading cause to hypertension. All those who drink alcohol, just try, like, have it in mind that you are just digging your grave to hypertension. And once you get hypertension, you have the tendency of getting kidney failure.
Exactly.
So why then don't you stop taking the alcohol so that you'll be free from all those sickness that we are even talking about?
Okay.
With these drugs that we are seeing, the only problem I have with it when you buy it, you will say the only thing you hear is not for 18 years pregnant women, but other disease is not even written on it that when you have this disease, that is the only problem you face. So if the government in a whole will come out and say that okay, all drugs that when you produce, just try those who are not supposed to take, because look at it is a one-way thing, not recommended for pregnant women and children below 18 years.
It also has to be prescribed, because there are those who just buy it without prescription. And is there a way that can also cause kidney? Because we heard people talk about that if you take herbal concoctions, even abuse medication, it can lead to kidney failure. Is that something that?
Because you realize that a percentage of people who come with kidney disease have a history of either abusing or taking this herbal preparation for some period of time, either to treat one illness or the other. So the main thing is, once they are approved, we believe that, but most of the things that the layman or the mere Ghanaian will take, most of them are not approved. Either you hear it on the radio or you are in a car, someone recommends it for you. Most of these things are not trustworthy.
Okay.
Yeah, and they tend to have these chemicals that are harmful to the kidney and tend to destroy the kidney in the long term, causing the kidney failure.
Okay. What about dehydration? Dehydration, having passed wateries too for a long time without management.
Yeah. So there are a lot of causes, from genetic causes to some syndromes. So dehydration is also a cause. It is put under the pre-renal, in the sense that, as I said, about 25% of the cardiac output comes to the kidneys for it to function.
Okay.
So when dehydration occurs, definitely the cardiac output and the amount of blood and fluid that comes to the kidneys will reduce. So it's like the kidney is not getting enough of what it needs to use to work. And once you're not getting it, basically it's like you are starving it. And if you are starving something, gradually you tend to die. Okay. So that is how come dehydration, either from diarrhea, excessive vomiting, someone who has hemorrhagic shock, all those things tend to reduce the amount of fluid or volume of fluid that comes to the kidneys.
Okay. So if somebody gets kidney failure, what are the symptoms that the person should?
So once you know you are an hypertensive or a diabetic patient, your symptoms will even directly or lead you to the kidney failure we are even talking about.
Okay.
Because hypertensive, what are we talking about? Fatigue. The least thing you do, you are tired. You always have test problem. The least thing you feel thirsty. So all those signs and symptoms that we see when we have hypertension are the leading signs you see in patients with kidney failure.
And so, is there no cardinal symptoms that you can?
Okay. So you can group them into 5 stages. Okay. Stage 1, stage 2, 3, 4, 5. But we don't want to go into the nitty-gritties. But what the books are saying is that from stage 1 to stage 3 is asymptomatic. Usually you can't really see specific things that are pointing to the kidney injuries. But my brother said that depending on your risk factors, if you have diabetes, hypertension, you see those signs. But when you get to stage 4, stage 5, that is where the symptoms tend to show up. Because what is happening is that the waste substances are now building up to a certain level that now the body can't handle it again.
Okay.
So you start to show signs of fatigue, nausea, vomiting, general body weakness. So these symptoms come as a result of the build-up of the waste substances.
The waste in your body.
If you have a lot of urea in the body, when it gets into the skin, you realize that your skin becomes itchy. When it comes into your gastrointestinal system, you have gastritis. When it gets into your brain, you have what we call the uremic encephalopathy. When it gets to your heart, uremic pericarditis. A lot of symptoms that will tell. And then one of the cardinal things that help us to see that this is kidney disease, not necessarily kidney disease in itself.
But a problem with the kidneys.
Yes, where you have the periorbital swelling, facial puffiness, and then pedal edema. Usually morning facial puffiness. When you wake up in the morning, realize that your face is swollen, your legs are swollen. All because the kidneys, which are responsible to regulate the fluid in the body, the function has been compromised. So now the fluid cannot be regulated.
Okay. So to summarize our symptoms, you mentioned that for the first 3 stages, stage 1, stage 3, it's mostly asymptomatic.
Yes.
In that you don't show any symptoms.
Any clear symptoms.
But later you can see some symptoms. And one of them you mentioned.
One of them that almost everybody sees physically is when you have the pedal edema, periorbital.
Pedal edema means that your face becomes swollen, at least as if someone has beaten you up.
Yes,
or something.
That's the facial puffiness.
Okay, and then your legs become swollen.
Yes.
And what about the amount of urine you produce? Is there an impact in it? Do you still produce urine, or there's a reduction? Or
there's going to be a reduction. Now, the fluid that needs to come out is not being shown on your face, shown on your legs. So those fluids are all down here at the top here. So your urine output is going to be low.
Okay. And so are there people who don't urinate at all?
You get people who don't urinate at all.
Goodness.
Some of the stages too, you tend to pee a lot. That is the polyuric phase before it comes to the oliguria and then the anuria.
Okay.
That is the absence of the urine.
Okay. If you don't urinate, then you're in trouble, isn't it? Because and you mentioned the other thing that it can lead to other complications.
Yes.
And can affect the heart, affect the brain, and all. Do you have many people suffering kidney disease in Ghana? I think Sebastian,
many you are. The word many is.
I mean, in terms of numbers
when you look at the whole business about kidney failure, I guess that at first diagnosing kidney failure was something not regular because the instrument or the things we use in diagnosis wasn't there. I guess now it's becoming easier for doctors to be able to diagnose that kidney failure is raw. And you guess that majority of the patients have come into contact is they come with diabetes, then hypertension. They are the people who comes and you see that, oh, you have diagnosed one patient for kidney for dialysis, why he's having uncontrolled hypertension, and they start small, start then. So you guess that it's not something you could say this or something you could say, but just that it is there. They are there. The numbers that they are there. Now we are every day. I can say on this that every day, if you take 50 patients that comes to the hospital, you get 2 patients to be diagnosed of kidney failure.
Yes, and is there types of kidney disease? We know of acute kidney injury, and how does the progression go?
Okay, so we have the acute, as I said, the acute kidney injury and then chronic.
Just to say that most of the time you see them start with acute.
Yes.
Acute is like the initial
sudden. Like you say, it's a sudden. So
exactly.
When it beseech you, when it comes to, or when you see that this thing is drawing,
coming to me.
So acute is acute, but once you don't treat something,
yes, it becomes a progressive.
So like, look, I use your own children and your own this. Your brother is misbehaving, so you tell the child that, oh, stop. You allow the child to continue what he's doing. To get to a stage, you can't control it. That is how kidney failure is. So once doctor said it is stages. So the stages that we are talking about, the stage 1, stage 2, and stage 5, will give you the difference between the types of kidney. That is the acute and the chronic. So the stages will tell you where you've got into, whether you are the acute phase or the chronic phase. But even in between, we have acute and chronic.
Sure.
Yeah.
So the acute and chronic is even more deadly than.
So just for the viewers' sake, let's try and explain it further, because someone will go to the hospital, there's a diagnosis of AKI. We say it's acute. And what does it mean to the person? How should the person take it? And if they say it's chronic kidney disease, how should the person take it? And if they say it's end stage, quarter, how should the person take it so that we can?
Just to summarize or just not go deep, acute basically, or in the large sense, is reversible, or the cause is something that happens suddenly. For example, you have you're going to eat something that is bad, and then you have acute gastroenteritis. You tend to vomit a lot. You're having diarrhea. All those things will lead to dehydration, and then the dehydration is going to lead to acute kidney injury. That is if it's very severe and it's not treated aggressively. Yes, so with dehydration, it can easily be corrected in a matter of days with the right IV fluids. So with that, we call it acute kidney injury, where it's happening sudden, and then most of the time it is reversible. You can regain the function of the kidneys. But once the kidneys tend to deteriorate over time, we have recurrent urinary tract infection. You have risk factors that are destroying the kidneys further. And we have some calculations that we do. If your GFR, that is the glomerular filtration rate, if it is less than a certain number, and you repeat it for 3 months, and then it lasts for 3 months, then you qualify to be called a chronic kidney patient. So with the chronic kidney, it's more of, and the causes most of the times are not reversible as compared to the acute. And then with that, the progression of the kidney disease can be delayed, or in some of the cases, it can even be halted. But in majority or some of the cases, they tend to progress from the chronic to the end stage. Yes.
Wow. Okay. So viewers, we are still discussing kidney disease and the fact that many people are having the disease. Sebastian spoke about it. You can still keep your comments coming on 0559 680066, 0559 680066. If you want to call us, you call us on 0302 959065, 0302 959065. So in the course of our discussion, if the call comes in, I'll just notify you and then we can do that. Let's look at the management of COVID, of kidney disease. Oh, I almost said COVID-19 because that's what we're talking about, all of these. How do you manage somebody who has kidney disease? Maybe I'll ask this before. Is there a cure for kidney disease? And then the next question will be, how do you manage it?
When you ask that question, you are just trying to put us in, how do you, is there a cure?
I
so
mean,
Doug rightly said that.
Yes.
Once it's like we are in the acute phase, it is reversible. Yeah. So once it is detected early that, oh, you are having AKI, that means we can reverse it.
Okay, so if you see it early,
it can be treated, then you'll be okay and continue your life. Okay. But once it is not seen at the earlier stage and it's detected later, I mean, there's no turning back.
Okay.
You go closer to.
Okay. But how do you manage it in the hospital?
So basically the management is also multidisciplinary. We have a lot of people coming into play. You need the renal specialist, you need a physician, you need a dietitian, you need basically everybody on board. Because the kidney is a very vital organ which does a lot of functions. So you need everybody on board to help in their specialties. So the management depends on the symptoms or the complication that has come because of the condition.
Okay.
So from the beginning, we said that the kidneys help in producing red blood cells that helps in your blood level. So now if the kidney is down, that means that you're going to have a problem maintaining a normal blood level.
Okay.
Therefore, you're going to be anemic.
Okay.
Realize that most of the time, when they do something small, they get tired, palpitations, headaches, and all those things. It's because the kidneys are affected.
Okay.
So when you're managing the anemia in the acute phases, or when the HB is very, very low, let's say below 7, we want to transfuse them to raise up their HB.
Okay.
But in the long term, we want to give them injection erythropoietin.
Okay.
Just
to pull up.
Yes, to pull up, so that, because that's the I'll say where the blood production starts. So once I'm able to give them something that will produce the red blood cells at that level, it helps them in a very long term.
Okay. And then we'll talk about your specialty with dialysis. And you just have to tell us briefly what happened to the patient who come for dialysis. What do you do for them? There's a caller on the line. Let's take the caller and get back to. Hello, good evening.
Good evening.
Can we know your name and where you're calling us from?
Yeah, I'm David. I'm calling from Lashibi, David Inkum.
Okay, David, we are listening to you.
Yeah, I'm very happy for what they are saying. But a little question I want to ask. I know from what they are saying, the kidney helps take out the dirt from the body through urine. Yeah. So I want to know that, when someone urinates and is clean or something, does that mean the person is not, the kidney is not working well for the person? So should we look out when your urine is dirty or something, then it shows that you are having a colorful?
Oh, okay. Okay. Thank you, David, for your question. I'll give you an answer. If the urine is, if there's a color, so supposedly it's very yellow, light yellow, does it give indication that there's too much waste in your body? And so.
Okay, I won't say it's an indication that there's too much waste. It tends to give you an idea about your hydration status. So when you urinate, then most of the time it's white or clear, then it's loose, or it tells you that your hydration level is satisfactory.
It means you're drinking more water.
Meaning you're drinking water. The level of water in your body is satisfactory. But if it's very deep yellow, it gives an indication that you are dehydrated. So therefore you have to drink more water just to change. It's better if your urine is most of the times clear than it's being deep yellow.
So it means that we can't see that the waste in our urine, the waste that the body brings out, we can't see it in our urine to say because I have this color means there's more waste in there. We can't see it.
Yes, not the waste per se.
Okay. Yeah. I think there's the other caller on the line too. Hello, good evening.
Hello, good evening.
Can we know your name and where you're calling us from?
Calling from Western North. I'm Godfrey.
Okay, Godfrey.
My name is Godfrey. I'm calling from Western North.
We can hear you now. Your question, please.
Doctor made mention of kidney stones.
Mm-hmm. Yes, please go ahead. We are listening.
Can he elaborate more on that?
Okay, so we want to find out how kidney stones can cause kidney failure. Okay, I think that's the question, Dr. Sheridan.
Yes.
So, the kidney stones, depending on where they are found, basically the issue is with the prevention of the flow. Now, the urine is not flowing or exiting from the kidney, so there tends to be a build-up of the urine. But it depends on the size. Some of the stones are very small that it can easily come out and then be washed through the, when you need it, so just pass. But some can be very big that they can tend to obstruct the pathway, leading to a build in the urine. And then the toxins can affect the kidneys in the long term, then causing the
so the kidneys can block the urine from coming out. And then the urine will pile up, enter into the kidneys and cause a lot of problem.
Once they're piling up, the toxins in the waste will lead to infections and the rest.
Okay. There's a question, unless there's a caller on the line. Hello, good evening. Hello, good evening. Can you hear us?
Hello. Good evening.
Okay, good evening. Can hear you now.
Yes.
Can you name where you're calling us from?
I want to find out. Okay. I want to find out if having regular sex can have any effect on kidney problem or not.
Okay, thank you very much. We'll get an answer for you. Having regular sex, that's it. Does it affect the kidneys?
Regular sex?
No, I don't think that's very interesting to say.
Not that we know of, so.
Hello.
Not that we know of. That's fine. There's another caller on the line.
Hello.
Yes, good evening.
Good evening. My name is Angela.
Okay, Angela.
I'm calling from Obuasi.
Okay.
Makion, please, I want to know if there's a connection between ulcer and diabetes. I don't know if maybe some symptoms of ulcer can generate or causes of ulcer can generate into you being diabetic. That is my question. Because the nauseous, vomiting and the diarrhea is almost, to me, are some of the symptoms of ulcer patients because I've experienced it before. So I want to know if there is a connection between the two. And the second part is if you go, if you don't show any signs and you go to hospital and maybe your BP is rising, will they do you a test or they will just put you on hypertension or hypertensive drugs, or they will do a test to know whether you are likely to develop a kidney disease? Thank you.
Okay, thank you very much, Angela. We'll help you out. Is there a connection between ulcer and then diabetes?
By her connection, I don't really get what she meant by the.
Because she said that she's had ulcer before, and the symptoms that she mentioned, nauseousness and the others, are similar. There's another question. Let's take the caller. We'll get back to you. Okay. Hello, good evening.
Hello.
Good evening. Can you know your name and where you're calling us from?
My name is Ellen. I'm calling from Kumasi.
Okay.
I wanted to find out whether when you urinate frequently, say something about your kidney being failing, or my second question too, what if you urinate and see blood at the end?
Okay.
What does it indicate?
Blood in urine. All right. Thank you very much. So let's try and deal with these questions quickly. The one with the ulcer and diabetes, where the symptoms are similar between diabetes and then
they might not have a very direct connection.
Okay.
But however, usually the symptoms look similar. But in order to distinguish between them, if the person is having what he or she thinks is ulcer, then you have to do the ulcer test, H. pylori, endoscopy, just to find out or rule it in. And then for the diabetes, you check your sugar level
to see if it is.
That is it.
And then she asked a question about hypertension and kidney disease. And that, she said, if you go and the BP is rising, can we diagnose of kidney disease? And I think the same point to go to what you just said. The fact that we need to do other labs to indicate that your kidney is failing before you can diagnose of having kidney disease. The second question, the second caller was saying, if you urinate frequently, does it give an indication of you having kidney disease?
Frequent use.
No,
so let's take this caller, I'll come back. Hello, good evening.
Good evening.
Can you hear me where you're calling us from?
Okay. Hello.
Hi, we can hear you.
My name is A.D. Valatora. I'm speaking from Bolga.
Okay.
Yeah, I had a sharp pain. I always have a sharp pain on my left abdominal side, and I actually went to the hospital for a test. I said I actually went to the hospital for to test to see whether it's a kidney problem. But then I promised to go back and then to get the result. But somebody directed that I should take bitter cola. And then actually when I started, it's like it's better. The pain is gone.
Okay.
But I want to take the medical advice of what I have to do the test. Yeah.
Okay. Sebastian.
You see, from what he says, he went to the hospital with a problem. He was asked to go and do some investigations. Once you've done the investigation, you have to go back. Go and seek proper advice from whoever asked you to go and do those investigations. Then you know the way forward. But once you didn't go and you went back listing someone to go and buy Michigoro, what is the rationale for taking that bitter cola you are taking? Is the pain you are exhibiting going to be suppressed by the Michigoro?
Well, he added by saying that after taking the bitter cola, the pain has come down.
No, sometimes it is the state of mind.
But the other point could be that there could be some properties in there. I think, but your advice will still go by is that get back to the hospital.
Yes.
So that whatever caused it, we can know and give
but Mr. Makin,
there's a caller. Briefly, I'll come back to you. Hello, good evening.
Hello, good evening.
Can you know where you're calling us from?
This Scare is calling from Cape Coast, Ankafo.
Okay.
Yeah. I want to find out eating too much, eating foods that are very rich. Hello.
We can hear you. We are listening.
Yeah. Eating food or fruits that are very rich in potassium. So much potassium. Can it also cause kidney disease?
Okay.
Or using a lot of food supplement, can it also cause a problem like that?
Okay, thank you very much. We'll get back to it. But
so you see, the first person's question he asked about the Michigo. I'm not against what he took, but you should have it in mind that assuming you are sick and someone tells you that, oh, I took paracetamol
and I was okay.
I was okay. Once that notion comes in, I also believe that when I take the paracetamol, I'll be well.
Help you.
Unless I have doubts about the medicine I'm going to take. So in a way, he believed that the medicine he's going to take will relieve him from his pain. But the question is, has he gone back to the hospital to check that the lab they went to, is there any deviation? Or so our advice now, he go back to
the hospital. Even if the pain has gone down, he has to
go back
to the
so
hospital.
that the doctor will give him more insight about it.
There's another caller on the line. We'll take all the questions and we'll go for a break and answer them. Yes, hello, good evening.
Hello, good evening.
Can you name and where you're calling us from?
I'm calling from Kaswa.
Okay.
Yeah. When you urinate and it's foamy, it's full of there's foam in it. What is the cause of that?
Okay, we'll help you out. And this question even came last week when we discussed the diabetes. There's another caller on the line. We'll take all of them. Hello, good evening.
Hello, good evening.
Yes, can you know your name and where you're calling us from?
I'm Thomas. I'm calling from Akumadai.
Yes, please, your question.
Hello? I want to ask that from the discussion, we have heard that water is very important. But sometimes people complain that when they drink water, they sense stomachache especially when they have not eaten, when they are hungry.
Okay.
When they are hungry,
when they are hungry, they drink water. They feel pain in their abdomen or in their stomach.
From the discussion, we have said that water is important in respect to kidney problems. People complain that they experience stomachache when they drink water, especially when they are hungry.
Okay.
So what advice are you giving to those people?
Okay, we'll get an answer for you. Thank you very much for calling. So a lot of text messages are here too, but we'll try and answer them. So let's be brief with the frequent urination. If you urinate a lot, does it mean you have kidney problem?
Not necessarily.
Not necessarily, but if you drink more water, then you actually expect to urinate more.
Yeah, and then sometimes to the climate, if
the weather.
The weather changes. If you're in a place where it's very cold, most of the urine is going to come out through by peeing them.
Okay.
But if you're in a very hot, sunny area, you're going to have you are going to lose water through your sweat and other things. So the urine production there will be low. It doesn't mean that person there is having a kidney problem.
Blood in urine, can that be an indication for kidney disease?
It can be as a result of infection somewhere.
Yeah.
Or an injury to the kidneys. That can also be.
So it needs to be checked up.
Yes. And high potassium rich food having an indication on the kidneys.
So before doctor talks, the kidney has a tendency of removing all those substances that are not needed. Once you take more potassium, you end up building more potassium in your system, and you end up getting hyperkalemia.
Okay.
And excess potassium in your body also end up impairing the functions of the kidney. So we are not saying don't eat much potassium, but anything it will have to.
There should be a balance.
There should be a balance.
And let's take this caller. We'll come back to you. Hello. Good evening.
Hello.
Good evening. Your name and where you're calling us from?
Please, my name is Richard Amwa.
Okay.
Please, my name is Richard Amwa. Please, can urinary tract infection cause kidney failure?
Okay, I think that the answer is yes, because we mentioned it earlier. Once you continue to have frequent UTI, you can develop kidney disease from that. All right, Richie, thank you so much for calling. Yeah. So we're talking about the potassium, so it can have an effect on the kidney, so there should be a balance.
That's why when we get to the dialysis, you get to know more about what the potassium will do. So they are the cardinal signs most doctors see when they want someone to do dialysis. When you come and have high potassium, they tell you no, this patient needs to do urgent dialysis, because the next moment there's going to be a problem with the patient.
So then let's talk about dialysis now, so that we can.
So basically dialysis is an option just to extend your life, just to give you some years in addition to your life. If you are to die maybe tomorrow, we are adding like 10 years to it, but with that 10 years, it comes with a cost. It comes with a major cost.
But is it fixed that everybody gets 10 years? No.
I'm giving 10.
No, so that
I'm just telling you that if you are to maybe go or die tomorrow, dialysis will just extend your.
So let's take this call. I'll come back to you. Hello, good evening. Okay, so if the call has dropped.
We are not saying basically once you have that you are going to stay.
Hello.
That's what I'm trying to mean. I'm just trying to going to extend the number of years you have to live. But let's do this calculation. I know of a dialysis center that takes 350 for a section.
But before we talk about the cost, we've said dialysis. What are you doing for the patient?
The dialysis is just.
A caller. I beg you. Hello, good evening.
Hello, good evening.
Yes, can you know your name and where you're calling us from?
I'm Owusu Mensah. I'm from Kumasi.
Okay.
Yeah, I thank the Honorable Minister for his submission. I have some inputs to make, but right now, let me focus on what you are discussing now.
Okay.
You earlier on mentioned, you talked about herbal medicine. Sometimes the way we make our submission, it looks as if herbal medicine is causing problems, but not. In fact, then let's ask this question: where it comes from that orthodox medicine? I mean, the main source is from head.
Exactly.
Majority, most of them. Yeah. So sometimes we have to make the submission. I mean, not that we want to. I mean, sideline those herbal as if they are not doing well. They are also making a very good work out there.
Yeah.
They are they are putting in their best. So, in fact, let's explain ourselves well better so that people will get to know, the real cause. Because some of the orthodox medicines are killing people. When you go to the drugstores, people just go there, I'm having pains, they buy those painkillers, and even those painkillers are causing damage to the kidneys.
They have side issues.
So let's balance it and know how best we can all solve these issues. Okay, thank you very much.
Thank you very much.
So I think we didn't outright say that these herbal medicines are not the best.
Good, sure.
Yes, Sebastian said that if they are approved and licensed by the Ministry of Health and Food and Drugs Authority, then it means that they can be used. But the ones that are not, because even when it comes to the orthodox medicines, not all medicines are indicated in any disease. There are some conditions where you don't take certain kinds of medicines. So we are not against herbal medicines, but we are saying that those that are licensed and approved and everything can be used.
Exactly. Let's finish with the dialysis. And you were talking about the cost. It looks as if it's an expensive
the cost, I don't know how government will help in these people, because it looks as if it's becoming a death toll on the eye, because sometimes you get that you really wish you could help patients, but you see, you can't. If you do it today, what of tomorrow can you do? Because look at this scenario. A patient does, if you are supposed to do dialysis 3 times in a week. Basically, that is how you are supposed to do 3 times in a week. And the section is 350.
Okay.
So 350 times 3 is 1,050. So if you are to do
every week 1,050,
a month is almost 4,000 something. What work is the person doing to raise 4,000 to come and do?
Well, if you don't do it, you have serious
if you
problems.
don't do it, just subtract the number of days you didn't do from the years you have. Then just it looks funny, but it's very serious. The government needs to come in to help these patients, because they are really suffering. If they can't even take all the costs, they can.
And there should be a subsidy
for them, so that because you realize patients are being diagnosed of kidney failure, and they tell you they don't have money, they are going home. They will go home, go and stay in the house, and you'll be there 3 weeks, 4 weeks, 1 month time. They will come back. That's the case. The patient now. That is when you see that they'll be rushing, looking for money. So the dialysis itself has its own problems, and the cost involved has its own problem, because doctor rightly said the kidney produces red blood cells and help in the production of blood. Now the kidney is impaired, so those patients basically they have problem with HB. What is so these NGOs, these big people, what are they doing about it? Do they have any specialized?
So now I like it. They are calling for more support.
I'm calling for more. Dialysis. Those people are doing dialysis, which they are really suffering. They need help from organization. Hope TV can even come support. Even if you can't give them money, we can organize blood donation for such patients, because they have. So if you have blood donation, you just come. 37 dialysis units. We are giving this number of blood for kidney patients, not for the whole hospital, for kidney patients. So if they come, just help them. Maybe you can't do it every 4 months, but maybe
you can do
once a year. When they hear that people are doing this for them, sometimes it's even encourage them that people think about them. You can't support them, but your blood can save something. So we really need you with what we are doing. You have to call people to come and support them. They are really suffering.
What about this issue of people do dialysis, they don't live long? Have you heard anything like that? Or does it happen? So how long does it take? Do you have somebody who has done dialysis for more than 10 years?
Doc, will be off, because doing dialysis doesn't mean that you are going to stay for a long period. We are just helping you. You see, the question is, dialysis is a 4 hours period. So you are sleeping on the machine for 4 hours. So if you happen, let's do this calculation. Your whole body is working 24 hours in a day. So 24 times 7. That's the number of days your kidney is working.
Number of hours.
Now for you, your kidney works within 3 days. So every other day.
That's
so maybe if
hours.
you are doing Monday, Wednesdays, and Friday, you are having only 12 hours in a week.
In a week.
I'm having over 100 and something in a week.
Yeah.
So you guess that you are being compromised of so many things there. Your body itself is not even able to.
Yeah.
So,
but the question I was asking is, do you have people who do dialysis who have lived for more than 10 years?
Yes, I know somebody who have done dialysis more than 10 years.
Yes. And that one is good because then you get an assurance that once that some people think once they start dialysis, they're going to die the next moment. And so many people will say, why will I spend all my money doing dialysis when I'm going to die the next day? But if people, people who have done dialysis for over 10 years, then I'm sure other people can.
And I know people too who have done dialysis and by God's grace in a few sessions
they recover and back to normal.
Yeah, and everything.
Yeah.
So every case is independent.
So that is when we come in that we have types of kidney failure, the acute phase and the chronic phase. Once we are being diagnosed of acute, you do it 1, 3, 4, 8 sessions. You are relieved of your disease and you go home and do your normal thing. You urinate like the way your kidney does the normal activity. But once it's not being treated at the earlier stage and it is being detected, when you get to the latter stage, I don't know what you are going to do to reverse it back. With the 5 years, with the 10 years we are talking about, it is good we can stay for but it comes with so many things. If you will do dialysis and stay for 10 years, then it comes with self-discipline.
Okay. But the other thing is that there's another thing called kidney transplant. That is one of the therapies, right? So in case somebody wants to do kidney transplant, that too can be done. Yeah. Yes, I just want that point to be established. But let's take some few questions from here. Okay. Our time is going. We'll still do the ACAN part. We just have a summary of all that we've done so far. Hi, I'm Captain Mold from Kumasi. God bless you, Bamakion, for that interview with Honorable Kojo Opong Nkrumah. Kidney and kidney-associated complications is now on the increase in Ghana and taking the lives of many of our loved ones. God bless you for this insightful education. Thank you so much, Captain Mo. I'm Timothy Boachi from Kumasi. How can I know that my kidneys are functioning or not? What are the causes? And Tim, if you're able to listen to our conversation now, you know what the symptoms are and what causes it. Please, what's the relationship between the kidney and someone having prostate cancer? Some from Dodowa. Is there any relationship between or difference between someone having kidney disease and someone having?
One of the complications of prostate cancer, especially when it is advanced or it is spreading, can cause hydronephrosis. Okay. And then the hydronephrosis will in turn lead to the kidney failure with time. Okay.
And when you urinate and the color is yellow, does it mean you have kidney problem? We answer that the answer is no. All right. With regards to your health program in general, I think it will be expedient to show pictures or caricature to enhance explanation, if you don't mind. Thank you so much, Richie, for this. We'll take note of that and possibly have some pictures to show. I'm Agatha Bachi from Kumasi. Can fat person get kidney failure? In that obesity, can obesity cause kidney failure?
There's a sure banker.
It has a link.
Yeah, it has a link to all other diseases. Yes. Good evening, please. My name is Sandra, and I have been experiencing painful urination. Please, what can be the cause? How do I treat it? And can this also affect my kidneys?
Painful urination could be a sign of a urinary tract infection. So we have to do some series of urine tests just to rule out any kidney disease and then just narrow in onto the UTI and treat it.
So he has to go back to the hospital for that. Okay. Thanks very much for this very important topic. May I know if drinking of excess water can have an effect on kidneys to cause kidney failure? This is Kwaku from Kumasi.
No.
Oh, okay. Good evening. I'm Edu Jemfi from Konongo, Dumasi. How can we relate kidney issues with the way our traditional medicine sellers talk about it? We had that discussion earlier and the caller also came to support it. But as I maintain, if it's medicine you are taking, there should be a prescription. You say take this amount of medication for this particular period so that you know what you are taking and you can do the side effects, than to take anything because it is medicine.
And just to add, most people think that or not most people per se, but the orthodox medicines do have side effects. And when you buy this drug, it is listed in the leaflet. Okay. So they clearly indicate that these drugs have side effects. It is not like it is only the herbal that has side effects.
Okay. Yes. So we'll go for a short break. When we'll come back, we'll do a summary of what we've done in the Akan language. and then we can break. There's an evening program at 7, which is the leadership program. We'll talk about that as well. So we'll go for a very short break. We'll come back soon.
Are you looking at unlocking life secrets, building a marital mindset, developing successful marriage habits, staying together, resolving conflict, and knowing whether you're a good parent? Then join us on Hope Channel as we present a 10-day relationship seminar under the theme 2 Hearts, 1 Beat. On set will be Dr. Daniel Day, Senior Lecturer in Ethics, Practical Theology, and Counseling. Ikwe, inspirational speaker, motivator, teacher, author, life coach. Grace Saki, Lancers counseling psychologist, educator, and retired midwife. Wednesday 15 to Friday 24th April 2020, 7 p.m. each night. Our special guest will be Willie and Elian Oliver, host of Real Family Talk on Hope Channel International, Director of Family Ministries at General Conference of the Seventh-day Adventist. Hope Channel, changing lives.
So we'll continue with text messages, WhatsApp messages, just then we can round up our discussion because of the evening program. So just to say that if my training team for 3 days in Twaso, and if you say program maybe at time ne yasu enti e be kan text message kaka na won na edwumede so aba ebe hello Emmanuel from Hohoi, please ask the doctor for me. I left dizziness for some. I felt dizziness for some days, and I went to the hospital. The doctor gave me medication. I took the medication. I realized that anytime I urinate, I smell the smell of the medicine. Does it mean that I have a problem with my kidneys?
No. The medicine is just being excreted through the kidneys. So,
hello, good evening. Please, whenever I urinate for a long time, and I urinate, I feel some burning sensation in my abdomen. Can it have an effect on my kidneys? Burn sensation of kidneys. Yes, Dr. Sherrod, what do you think?
It
doesn't have any relations to that. Okay. Then let's quickly round up with your last message, but let's look at the prevention of kidney disease. So we can just round up as we talk about that. Yes.
So basically, I always want to say that if you want to prevent any condition, the new start, especially your nutrition, exercise, water, all those things help to build your overall health. And then if you have a risk factor like hypertension, diabetes, make sure you are having regular checks with your doctor or physician just to check all these things. Then we have regular investigations to pick up anything that might arise at the early stage.
Okay. Yeah. Sebastian.
So what I'll tell my fellow viewers is with hypertension, listen, don't think that once you are being diagnosed of hypertension, you will die. Once you take your medication very well, you you eat very well, you will stay for a longer period. So once you are being diagnosed of it, don't be afraid that, oh, I've been diagnosed of hypertension and diabetes, so that is the end of, no, that's not the end of your life. Take your medication very well, report to the hospital anytime you are not feeling well, drink more water, eat very well, exercise very well, and I think it will take you far.
Okay. So thank you very much, Dr. Sheridan, and thank you, Sebastian, for joining us today for our discussion. Yeah. And to our viewers, thank you for joining us for today's discussion. We're speaking about kidney failure, the fact that it's real, many people are having it, and Sebastian gave us an indication that there are people who come for dialysis, on a daily basis because of kidney disease. It's real. We've said this in relation to COVID-19, that if you have kidney disease, the chance of getting COVID-19 is high, and when you get a COVID-19, chance of suffering and even dying from it is very high. So if there's any problem with your kidneys, can report to the hospital and go by the treatment that you are being given. And I hope that with the prayers and the trust in God, a lot can be done for you. So God bless you. Stay safe, stay healthy, drink more water, go by the new start, eat well, but please stay at home so we can all save ourselves from COVID-19 and kidney disease. God bless you for joining us. We'll see you next week.
Furniture provided by Ash Foam,
Presenters Fabric by GTP New Style, Makeup and Grooming by Second Image Beauty Academy. Special thanks to Valley Mineral Water. Hope Channel, changing lives. Hope Channel, changing lives.